Hi everyone. My name is Phoebe, and my group is doing Korean culture and traditions. And we have a tour guide, Granny, and she will guide us through the journey.
안녕하세요. So, my name is Gwenny and I'm going to be your tour guide. We're going to be showing off our culture, Korea. And our group, we have Princella, we have Phoebe, and we also have Bleida. We're going to show you what our culture is made of, the symbolism, some meanings, and some more. And we want to make sure you have a good time and just let us know if you have any questions. And let's go ahead and dive in right now.
We're gonna first cover culture identity.
I'll be talking about culture identity of South Koreans. So almost half of all Koreans share only five family names, and they distinguishing among them is the gene challenge. And all the brothers and sisters in the same family, they share a second given name, and that is also known for their generational names. And for Korean culture, the father role is the central role for the social structure and also in day-to-day living. And all the Koreans share only one language, and which was invented in the mid 15th century. And Korean culture focuses on Confucianism too, and it plays an important role in Korea's political and social culture. And the Korean, they are group-oriented societies. People are divided into hierarchically into inferiors and superiors based on class and sex and age and occupational. So they have they are all focused on groups, and they are all respect the like superior classes. And next slide, please. Okay, so religions, there are three major religions in South Korea. So almost half of the population has no religion at all, and 23% of the South Koreans are Buddhism, and 29% of them are Christians. And it has been grown rapidly over the past century, and only 11% of the South Koreans are Catholic. And now I'm going to talk about the four major holidays that South Korea celebrates. And the first one is called, I'm not sure if I can pronounce it correctly, Sola. So that's the second half moon after winter solstice, and that's the first day of the Korean lunar calendar, and considered the Korean New Year. And it generally falls in January or February. And the second holiday is called Chuseok, the eighth full moon. That's the Korean version of a Thanksgiving Day. And the third holiday is called Dano. So it's the Spring Festival, which falls on the fifth day of the fifth month of lunar Korean calendar. So people are just celebrating the harvest. And lastly, it's the holiday is called Hansik. So basically, everyone's enjoying and eating the cold food. And this day is the 105 day, the fifth day of Dongzhi, which is on April the 5th. And so here are some pictures of the holidays and what do I do on those holidays. So like on the upper left corner, so they are celebrating the Chuseok in the family. And this is on the other side, on the right-hand side, that's the dance they do on Dano. And on the bottom, that's the cold dishes they are eating for Hansik. And now I'm going to pass to Glenn, and he's going to talk about symbolism and meanings.
Thank you so much, Phoebe. So right now we're going to be talking about Korea's symbolisms and meaning. But first, we have a little bit of an introduction. So Korea, they have a culture that represents a very rich symbolism. And a few of the symbols that we're going to be discussing are traditions, food, and even animal symbols that are connected to the roots of Korea. So the first symbol that we're going to be talking about is the hanbok. Next, please. So the hanbok, it's a clothing garment that is worn, and historically it represented class, rank, gender, and marital status. So the hanbok, it consists of two pieces, which is a jigori and a chima or a baji. So the jigori is an upper garment that is worn like a jacket. It's the upper garment, and the chima is a long skirt, and a bali is worn like pants. And next, please. So this symbol that we're going to be discussing right here, this one is the tradition that is usually done on wedding days. So during these days, there's a meal that consists of soup and noodles, and it's called the janchi gutsu. So these noodles, it symbolizes that people will be able to live a long and a happy life. So it's almost perfect to be eating these on a very special day with your partner, so you both could have a very long and happy life. Next, please. So this last symbol that we're going to be discussing is about animal symbolism. There are many animals that pertain symbols for Korea, and a few of them, there's dragons, tigers, rats, roosters, etc. And this is very similar to the Chinese zodiac signs, if you want to compare to that. These animals symbolize wisdom, loyalty, freedom, nobility, wildness, stamina, and many more. Next, please. And next, I will be passing on to Princella, who will be taking on the next section.
Okay, so I will be going over family roles in Korea. So, in most married households in South Korea, a typical family consists of parents and two children, along with the grandparents. And as far as the traditional roles within the Korean family, the father typically assumes a dominant role and by providing and making significant decisions for the family. The mother, on the other hand, she plays a vital role in maintaining the home and focusing on raising the children. There's also extended family that lives with them, which includes the grandparents, aunties, and uncles, and they all play a significant role in raising the children. And the bonds between like the parent and their children in South Korea are exceptionally strong, and this closeness is marked by a sense of shared responsibilities within the family unit. So as far as the role of children in Korean culture, the bond between parents and children is highly valued and is deemed to be very important. Parents have a significant influence on their children's lives, and they often have high expectations for their academic and career achievements. However, these expectations can create really immense pressure for their children. Respect and obedience towards elders are ingrained in Korean culture, and children are expected to uphold these values. The eldest son, in particular, he is often responsible for taking care of his aging parents and ensuring that their needs are met. In Korean culture, children are taught to recognize that they owe a debt to their parents for bringing them into this world and raising them. This is called filial duty, which is a crucial aspect of Korean culture. Filial duty is the cultural expectation that children have responsibility to respect, care for, and support their parents, particularly in their old age. So as far as caring for the elderly, the issue of elderly poverty, it currently is one of the most pressing social issues in Korean society. Studies out there show that a significant number of elderly Koreans are living in poverty, um, as they are struggling to meet basic needs such as food and shelter. Traditionally, Korean society has been family-centered, and elderly patients were often taken care of by their adult children. However, as society continues to evolve, this family-centered approach is shifting, and more elderly adults are seeking independence by living alone or with their partner. As a result, the responsibility of caring for elderly parents is no longer solely on their children. And so instead, society as a whole needs to take a more active role in addressing these issues of poverty for the elderly and ensuring that the elderly population has access to resources in order for them to live with dignity and independence. And it's also important for the Korean government and other social institutions to work together to provide financial support as well as healthcare and other resources to elderly Koreans in need. And here are just the Korean family vocabulary. So these are ways to address family members in the Korean culture. And I will hand it over to Bleida, who will be going over the nursing implications.
Thank you, Princella. Now I'm gonna be going over nursing implication. Next. Nursing implication. We have to be aware that we have to ask our patient, what do you call your problem? When did you start? When did it happen? What do you think caused the problem? Have you taken any medications? What are the results? We ask them, what do you believe the illness is, if it's serious or not? And we also ask them, how is your life going lately? So they can express how they're feeling. And we can express them if you ask them if they're experiencing any stress, disagreements, or any misunderstanding in their life. Many patients seek medical care for Hanaud, and a traditional herb doctor in Korean. And Hanayak or herbal medicine are widely used. Just as the ginseng as a popular herb, they can drink it either in pills or tea. And we can also build bridges between folk medicines and Western care. When considering folk practices, we need to determine when the remedies are beneficial, neutral, or harmful for their health. We can also incorporate beneficial and neutral remedies into the care plan because it's something that they are used to, and some they can still take it, but some others not. And then we have to consider the potential drug interaction. Next, please. Thank you. How we manage the medical news. Bad medical news is often chilled by the patient. The family may believe that the patient is not in a condition to receive the news because they have hope that they can be cured. We can also ask the patient how she wants to be included in the medical decision. When possible, engage the whole family in discussions that involve decisions about care to have the family support. Because of the traditional Korean values of the loyalty, the patient may trust that the parents and the family will make the best decision for them. Therefore, advance directive may be seem unnecessary to the patient and the family. Another consideration would be that the need to be informed consent process may be a new experience for your patient. If it's your patient first experience with informed consent, explain the purpose of why are we doing this. We ask them if they want to be included in medical decisions or not. If the patient does not want medical decision for themselves, they can let them know to prepare a durable power of attorney for the healthcare. The same is if they want to pass it to the family, that the family can make the decision for them. Next. How does Korean culture deal with illness? We have to explain the patients how the illness is gonna affect them, because most of them, they follow religions such as Buddhist or Confucian doctrine, viewing illness and death is as a natural part of life. They also, their symptoms can be seen as a bad luck, karma, and a payback for something that they did wrong in the past. We have to be aware our patient illness may be a response a stress in the family and other interpersonal relationships. So we always have to assess for what is going on in their life to help them get to a conclusive medical diagnosis, and we can help them in a holistic way. Health may be viewed as a finding harmony between complementary energy, such as a cold and hot, female and male, and dark and light. These are forces are called the yin yang. Next, please. So what are the Korean culture norms about touch? We have to understand that in this culture, norms about eye contact and body language are really important. We do not expect to look at them or stare at them for long. When we first met your patient, he or she might be frequently look at you when you're not looking to become more comfortable. Handshakes are appropriate between men and men. Women do not shake hands. Respect is shown as authoritative figure by giving a gentle bow. We need to understand personal space. Your patient needs space, and they highly value emotional self-control, appearing stoic. We have to be aware that a patient may be shown no pain. They don't want to feel or show weakness. They may not ask for medication, but we can instead ask the patient, may I get you something for pain? Even if they don't ask, but when we offer them, they will take it. Most of them, they will take it. We have to respect their desire and keep their emotions in control when asked about upsetting matters. Understanding the norms and modesty, we have to consider that women and girls, when giving a pelvic exam, they may only want to be treated by a female nurse, so we have to respect that. In some cases, they may refuse any exam, and we have to respect that. Next. Something really important is understand medications and help them that since they believe in Western medicine, we need to explain that the medicines are strong and they may not take the full dose or complete the course of treatment. They may not do it, not take it. Or patient may cut the dose in half or stop taking the med because they're feeling better. So we have to explain then that the dose is customized for their weight, their height, and their metabolic need. We have to describe them to take the full dose, whether they feel better or not, and they have to do it right away. And always ask them open-ended questions. And also to be aware, we have to alert them that our patient may have some enzyme deficiencies, and which require the reduction in medication dose. We can contact pharmacy and consultation for medication, especially in the older population. We have to be aware. Next, so some nurses news. In 2026, South Korea is expected to become a super age society in which is going to be a lot of elderly people. Those between 65 and above make up out of every 5 people in the total population. This will be unavoidable, and it will create a great demand for elderly care. So every nurse that is interested in that area will have a lot of work in that area.
Thank you. That concludes our presentation on Korean culture and tradition. Thank you.
Thank you.
감사합니다.